The toxic, illicit drug supply continues to have a profound and tragic impact on the people of British Columbia.
Another 175 people have died from overdoses in July alone, the vast majority of them connected to fentanyl. And it's a crisis that isn't limited to the downtown east side, but touches every region of the province. In 2020, the majority of illicit drug toxicity deaths took place inside private homes, followed by other residences, which include social and supportive housing, and finally, outside. And more men are dying compared to women. LaPointe says the pandemic has restricted access to critical harm reduction services, and BC's top doctor agrees.
It's also dismaying to know that all of the work that we have done around responding to COVID-19 has been a contributing factor to the numbers of deaths that we're seeing from the toxic drug supply.
A big issue has been reduced hours at supervised injection and overdose prevention sites. And both women agree ongoing stigma is keeping people away from those life-saving services.
I implore anybody who is using drugs right now, do not do it alone.
For others who have lived through the pain, the news was tragic but expected.
My heart is broken, but also I'm incredibly frustrated by the slow pace of change in our federal and provincial governments.
After McBain lost her 25-year-old son Jordan to a drug overdose, she founded the group Mums Stop the Harm. She was part of an advisory board for the province, but earlier this month, they walked away from the meetings over a lack of urgency.
The only thing that actually makes sense around the holdup is the unwillingness of the people at the top and the people who can change policy to do the courageous thing.
So what does McBain think the courageous thing is?
For access to safer supply.
Having access to a safer supply.
Implement a safe supply of drugs.
So with a clear answer from the experts, what's the holdup? In a statement, the Ministry of Health and Addiction says they're working on it. In March, BC made it easier to prescribe hydromorphone. And now, an evaluation is underway to better understand the impacts of prescribing the drug. But McBain knows that for many, it's already too late. Joel Ballard, CBC News, Vancouver.